I'm Cheryl Bongiovanni, and I am the director of Lake Wound Clinics. We take care of, again, our full spectrum, everything from venous leg ulcers, diabetic foot wounds, infected and dehisced surgical wounds, burns certainly, you name it, it gets sent to us. Understand, of course, that every patient we see is, in fact, a treatment failure. Presented to us last Thursday, that would be June 12th, with multiple small ulcerations on the dorsum of her foot here, badly swollen leg, quite a bit of erythema, and discomfort. What we did was we washed the entire area with lots and lots of Dermacyn. The discomfort went away, and so we were then able to address the ulcerations and the tremendous edema. This leg was pretty much swollen to tension. We've addressed the swelling with what you see coming off now. This is an Una's boot, and we're eager to see how our ulcerations and the cellulitis affecting her foot and ankle are responding to the Dermacyn treatment. Although I can tell right away already this is much improved. As you can see, the erythema has largely resolved, and it was red up to about there. That sure looks good. All those little ulcers are gone. We do have some dry skin. What we're going to do is clean this up with a little more Dermacyn. This is just Dermacyn sprayed on sterile 4x4 gauzes. And yes, the swelling is all gone. Remember all those little ulcers that we had?
Yeah.
They're all gone. Nothing is bleeding. Probably the most dramatic result that we see immediately upon application of Dermacyn to any wound is the fact that the wound odor is resolved completely. This foot looked freckled all the way up to here with small ulcerations and some purulent looking blisters that had yellowish matter in them. That is all gone completely. There is no more blistering either. Here at Lake Wound Clinic, for the most part, regardless of wound modality, our average time to heal is 21 days. That's true for most everything. It's certainly true for this young lady. And as you can see, this is what we use. And our patients come in for a dressing changes. We'll soak the extant dressing and bandage system with Dermacyn and let it sit there for 10 or 15 minutes. This accomplishes a couple of things. It precludes the spread of infection here in the clinic. Understand that here in our wound clinic, every patient we see is a treatment failure from somewhere else. And as a result, we're constantly vigilant, but we do worry about the spread infectious agents, especially here in the wound clinic. And with Dermacyn and being able to soak an existing bandage with Dermacyn prior to removing it and treating the underlying wound again, that becomes a non-issue. So we're grateful for that, certainly. But the dramatic difference in this foot is pretty much breathtaking. This is a real miraculous substance called Vaseline. Okay, it is straight Vaseline. And the only reason why I'm using that, I've used plenty of Dermacyn. And I'm just going to put a little bit of Vaseline to keep my pressure bandage from drying her out any further. But as you can see, that is perfectly healthy, and you would not have believed what this looked like 4 days ago. This is a pressure bandage. I can tell you that I'm putting somewhere between 25 and 30 millimeters of mercury compression. But understand that for something that has been troubling this nice lady for a great while, Dermacyn allows us to employ a low-tech, comfortable, and extremely cost-effective solution to the problem. Now we cover this with a piece of stockinette only because the co-band can be a little tacky, and we don't want her to end up winding herself up into the bed sheets at night. So this is just cotton stockinette, covers the co-band.